Hello everyone, I'm Renee Scott and this is Moms Every Day. Joining us from the Alaska Sleep Clinic is Brent Fisher and Dr. Kelly. Welcome, gentlemen.
Thanks for having us.
So Dr. Kelly, what's the link between heart disease and sleep apnea?
I think that's a really important question. Heart disease and sleep apnea run together. And I think the most important thing to remember is, what is sleep apnea? Sleep apnea is when you stop breathing 5 to 30 or more times per hour at night. This can lead to increased inflammation, stress on the heart, specifically through hypoxia, lower oxygen saturations that can end up increasing your risk for all of these important cardiovascular diseases, including high blood pressure, pulmonary hypertension, heart failure, and stroke. Specifically, sleep apnea is associated with a 130 to 140% increased risk of heart failure, 60% increased risk of stroke, and a 30% increased risk of coronary heart disease.
Wow. So could a heart condition be sabotaging our sleep?
It's hard to know exactly. The pathophysiology works closer that sleep apnea leads to all of these cardiovascular risk factors, but certainly so. I think the more important story here is that if you're being evaluated for poor sleep, a physician or clinician should be thinking about reducing your cardiovascular risk factors, high blood pressure, high cholesterol, obesity, exercise. And similarly, as a cardiologist that's focusing on your cardiovascular health, we should be asking about the quality of your sleep and trying to reduce that significant risk factor and screening people for appropriate possible sleep testing.
That makes sense. So they just go, heart disease and sleep goes hand in hand.
Absolutely.
That's wonderful. Well, Brent, where can we go to learn a bit more?
alaskasleep.com.
Well, it's always a pleasure to have you, gentlemen. That was your Moms Every Day.